All right, so today we're going to talk about a topic that affects millions of people, but, is often kept behind closed doors: premature ejaculation. And we're going to go way beyond the usual treatments. We're going to look at some really groundbreaking new technologies that promise a more effective, on-demand solution.
So, to kick things off, let me just ask you a question. When you think about patient complaints, what do you think is the single most common male sexual disorder out there?
Well, if you guessed premature ejaculation, you're spot on. Some studies show that as many as 20 to 30% of men have reported issues with it at some point. I mean, think about that. That is a huge number. And it really shows that this isn't some niche problem. It's a widespread health condition that is seriously in need of some innovation.
But what does that term actually mean from a clinical standpoint? To really get a handle on the new solutions, we first have to have a super clear definition of the problem they're trying to solve. So, the International Society for Sexual Medicine, they give us a very specific definition. And what's interesting is it's not just about the stopwatch. It's really a combination of three things: a consistently short time to ejaculation, not being able to control it, and crucially, the negative impact this has on a person's life.
Let's break that down just a little bit more. So you've got three main components. First, there's time. We're talking about ejaculation happening within about a minute almost every time. Second is control, which is that feeling of being unable to delay it. And third, and this is maybe the most important part, are the consequences, the very real distress, the frustration, that can even lead to avoiding intimacy altogether.
Okay, so treatments have been around for years, but here's the thing. They come with some major drawbacks. And this has created what researchers call a significant unmet need. Basically, there's this huge gap between the solutions that are available and what people actually want and need.
This slide just lays out the problem so clearly. On the left, you've got your current options: pills and creams that you have to plan for, which kind of kills the spontaneity, right? They can have side effects, and their effects are only temporary. So it's no surprise that adherence is super low. Very few people actually stick with them. But on the right, you see the goal for new tech, and it's the total opposite: on-demand, drug-free, easy to use, and actually effective. And this, right here, is where things start to get really exciting. To meet that need, we're seeing this new wave of tech solutions starting to emerge, and they're all designed specifically to be drug-free and to work on demand. So let's walk through three of the most promising new technologies that are being looked at right now. Each one takes a really unique angle on solving this problem. Okay, first up is a device called the Into patch. And what it does is it uses a pretty well-established technology, neuromuscular electrical stimulation, but in a totally new and innovative way. So how does it work? Well, it's actually remarkably simple. A small patch gets applied to the perineum, that's the area between the scrotum and anus. Then it's activated right when it's needed, during intercourse. The patch sends these gentle electrical signals that continuously stimulate the pelvic floor muscles. And that stimulation is what helps inhibit the ejaculatory reflex, delaying the climax. Of course, the big question is, does it actually work? Well, the clinical trial data for this patch is pretty compelling. The placebo group, or the sham group, they saw a pretty small increase in time, about 18 seconds. But the group using the actual device, they saw an increase of 56 seconds. That's an improvement 3.1 times greater, which is a statistically significant result. It's proof that the tech really does something. All right, the second technology is a little bit different. It's called transcutaneous posterior tibial nerve stimulation, or TPTNS for short. The idea here is to stimulate a nerve down near the ankle, which is believed to influence the neural pathways that control ejaculation. It's a really interesting idea, but it's important to know that so far the studies on this method have been kind of conflicting or just inconclusive. And the third innovation is the myhixel system. Now, this is a pretty fascinating approach because it combines a specially designed masturbation aid with an app on your phone that walks you through a behavioral training program. The whole goal is to help you train your body and your mind to get better control over that ejaculatory reflex over time. So let's just pull this all together and do a quick side-by-side comparison. First, you've got the Into patch, using direct stimulation, which showed that 3.1 times greater improvement over a placebo. Then there's the tibial nerve stimulation, where, the jury's still out. And finally, you have myhixel, that combination of a device and training, which showed a pretty significant increase in time compared to just doing the training by itself. So what does this all mean for the future of treatment? Well, we're seeing this really clear shift away from that one-size-fits-all pill approach, and we're moving towards more personalized, user-controlled, technological solutions.
You know, the researchers behind our source material, they really put it perfectly. They said, solutions that are drug-free, entail minimal adverse effects, and permit spontaneity during intercourse are on the horizon. That quote just perfectly captures the promise of this whole new field. We're really entering an era where technology might just solve a fundamental human health issue in a way that medication hasn't quite been able to. And that leaves us with one final big question to think about. Could technology finally offer the kind of spontaneity that medication never really could? All right, so today we're going to talk about a topic that affects millions of people